What are Caesarean Scar Ectopic Pregnancies and how common are they? An introduction to the importance of an increasingly common complex condition of pregnancy.
Hello, my name is Cecilia Bottomley and I'm a specialist consultant in gynecology and early pregnancy based in London, UK. About a third of women will experience some bleeding or pain during the first 3 months of their pregnancy. We have many years' experience as the leading centre for diagnosing, usually by ultrasound, and treating such early pregnancy problems. The most common complication at this time is the loss or miscarriage of a pregnancy that was developing in the normal place inside the cavity of the uterus or womb. Less common is an ectopic pregnancy, which has developed outside the uterine cavity. Most often the ectopic pregnancy becomes stuck in one of the fallopian tubes, which are supposed to carry the early pregnancy to the uterus. When this happens, the pregnancy always fails or needs removal because the tube is a hollow structure which cannot support the pregnancy. Ectopic pregnancies can develop in other abnormal places. As caesarean deliveries have become much more common, we're seeing an increasing number of pregnancies which have implanted not in the womb cavity or fallopian tube, but into the gap in the uterine muscle, known as the scar, following a previous caesarean. We call this a Caesarean Scar Ectopic Pregnancy, and this is a much more complex condition to assess and manage. The chance of this happening increases with the number of previous caesarean deliveries a woman has had.
Patients with Caesarean Scar Ectopic Pregnancy often present with pelvic pain and bleeding and a history of previous caesarean sections, but in many cases there will be no warning signs. Around 2/3 of Caesarean Scar Ectopic pregnancies fail in early pregnancy. The majority of cases that continue into the second and third trimester can be associated with major complications such as massive hemorrhage. In half of these cases, the placenta may also become abnormally attached to the scar area, which is known as a placenta accreta. It is important to diagnose a Caesarean Scar Ectopic pregnancy early to provide patients with counselling about the risks associated with it and help them to decide whether to continue with the pregnancy or not. Ultrasound imaging in expert hands is very accurate and allows management to be tailored to the needs of each individual patient.